having a granddaughter that's 4 months old, you know, that's been living with me. I have to make sure I'm even more cautious when I'm out and about and seeing people when I go home. And people don't get it. And that's been the hardest issue. The million-dollar question, people keep saying, why are our numbers worse than it was a year ago when we didn't have vaccine? And we did say, if you vaccinate and you get the 2 shots, you don't have to wear a mask if everyone in the room's vaccinated. We did not say you weren't going to get COVID-19. We did not say it wasn't going to happen to you. You know, and I don't know why, and I say this all the time, people think now they got an S on their chest. And I will say to the people listening to this and to the viewers, just walk around. Going to any store, no one's wearing a mask. I've been very alarmed that people over 65 that aren't wearing masks that are out and about, because people are like, we got the shot, and I get it. I get it. No one wants to wear the mask anymore. Everyone's done with COVID. No one wants to read about it. No one cares. But there's still people dying, and there's still people getting sick, and there's still people who are getting COVID, don't realize they have it, and transmit it to someone else. You know, my 2 brother-in-laws are fully vaccinated. Both of them just got COVID last week. My niece got COVID, fully vaccinated. And you see this happen because people are out and about and they just get it. They weren't sick. They just got it and had a quarantine for 10 days even though they were fully vaccinated because they had COVID and they had a head cold. So as of today, there's 115 new COVID infections in the last 24 hours. We've been seeing new daily increases, triple digits, more and more lately. Last week we had a 5-day stretch, and on Thursday we had 191 confirmed COVID cases, the highest single day increase since January 28th of this year. Since yesterday, there are also 8 new hospitalizations, 41 county residents currently hospitalized, up from 38. 1 hospitalized person younger than 18. There are currently still 4 people in the ICU, unchanged from yesterday. And it's important that we remember that the situation looks like this time last year ahead of the holiday season. So if you go between October 24th and November 24th of last year, I'm talking last year, there are 1,756 cases of COVID infection, 113 new hospitalizations, and 8 new COVID deaths. Now let's compare it to last month of this year, and 2,764 new infections, 136 new hospitalizations, and 19 COVID deaths. So it was much better this time last year than it is this year. The difference of more than 1,000 infections compared to last year, and more than 2 times the number of people passing away over last year. The best way of protecting ourselves is getting people vaccinated and making sure they're able to get the booster. With the rise in numbers, we're expanding vaccine clinics, including those based out of our local schools, which we've been running. And you'll be seeing next week we have clinics at the Albany Airport, Manans Union Free School, where we will be back at the Blue Creek Elementary in Gilliland the following weeks, along with others to follow. So we are really trying to get out there, and with the pharmacies and everyone else out there and the sheriff's department out there giving vaccines, of making it convenient and easy for people to get it done. We know that the infection rates are going to increase after Thanksgiving tomorrow. Was one of the reasons why we're doing the briefing today. We're set on pace to crush the numbers of last year, and it's alarming. And I just want to say to people, I know they want to get together with their families. Just do it safely. If you're not vaccinated, wear a mask, stay 6 feet apart, clean your hands, cough into your arm, everything that we've talked about, and we'll get through this. And if you get tested, too, please get tested before, get tested after. We have seen an increase in people wanting to get the vaccine before tomorrow, you know, that were either traveling or planning on getting together with family. Either they want to get the booster shot, their first shot, or second shot, which is all good stuff. I don't want to be up here and deliver bad news, but my highest priority is protecting the health and safety of our residents of Albany County. We can't stick our heads in the sand and pretend like we're not dealing with anything. So I have to say to people, I said this early on, I said it 23 months ago, and I was hoping I was wrong. It's a marathon, not a sprint. We're going to be in this for a while, and it's probably going to go well into the spring of next year. I know the mental health of people has really been affected the most. I know people with opiate addictions and other addictions are falling at the wayside because of what's going on. I kept saying we had to reimagine the world, the workforce, what we did with things in life and how we handle things going forward, and especially dealing with families. It's tough. I get it. I get it. But we all need to do our job. We all need to do it. And like Bill Belichick said, just do your job. You do your job, we'll get through this. But it's not going away. We can't wish it away, I can tell you that. Remember in January of this year, we had 89 COVID deaths in Albany County. 89. And I don't want to see that number again. I don't want to go down that road. And I'm afraid of the way, the direction we're headed today. It's going to happen. It might happen in December. It might not. And I'm not here to scare people, so all my Facebook people like to put the comments out there. I don't want to be sitting here. I don't want to be preaching this 23 months later. And I sure as hell don't want to be scaring people and saying, you know, get your shot, get vaccinated, or something's going to happen to you. So please, please, we can get through this if everyone rolls up their sleeve and gets the vaccine. Just to put a little things in the right view, the situation in western New York is the worst of any region in the state. The Finger Lake region is close second, and we're not there yet, but the situation continues to get worse. After Thanksgiving, it gets to where western New York is now. We're considering our new COVID restrictions. The governor also will be discussing possible implementation of new health regs to protect New Yorkers. Infection rates continue to rise across the state. We've had meetings, and just to give you a little idea, the 7-day average, Albany County, we're 5%. Not bad compared to other counties. But let's remind everyone, last year, the biggest argument where Dr. Whalen and I were having was sports, and we had to get to less than 4% to open up sports again. We're at 5%. And I know we're not looking at the matrix like we did last year, and things have changed, and we're basing it on hospitalization beds, and we're basing it on ICU capability. But just think about that. How far we've come, we change. You make rules, you make decisions based on the health and safety of the people we represent, and things change. We learn from things we did last year, and we've changed, and we adapted. But I just want people to think about that. 5%, we'd be shut down. Remember? Couldn't even get movie theaters open. Couldn't get rolling Guptals open. You couldn't do anything because we're at that 5%. Schenectady County's at 5.9%. Saratoga's at 7.2%. Columbia's at 8.6%. Warren County, 8.9%. Washington County, 12.4%. Currently the highest of any individual county in the capital region. So, you know, that's just the positive rates. The regional rates, again, capital region as a whole, we're at 6.8%. New York City as a region, 1.7%. Mid-Hudson Valley region, 2.9%. North Country, 7.2%. Finger Lakes, 8.6%. And Western New York region, 9.7%. I would prefer the governor to act instead of Albany County have to go it alone, like Mark Poloncarz did out in Erie County and came up with 4 points. We've been on numerous phone calls with the governor this weekend, Sunday, Monday, talking about different things. President Biden put an executive order out through OSHA through 1910 that's saying by January every workforce over 100 has to be vaccinated. I know that's being challenged in federal court right now, but I have imagined that will pass. So OCA passed mandatory vaccines. I don't want to go there, but we're almost there, and we need to continue to do our job, and we need to work on this together. And I don't want to keep coming up here saying I'm going to take steps and mandatory stuff, but I'm getting there because the numbers aren't better. And people can argue the masks don't work, you know, whatever. We know what works, what doesn't work. It's just another tool in the arsenal that helps somebody from spreading it or getting it. We're not saying it's perfect. I'm not going to argue masks are perfect. I'm not going to argue anything that we're doing is the perfect solution. But we need to continue to work together as a community. Stop finger pointing, stop fear-mongering, stop saying things don't work and threatening people that don't believe in the vaccine or want to wear their mask. We need to work together. So we need to get people the shots. We need people to wear the masks. As I was saying, we need people to get tested. Testing has become an issue. And one of the things we have identified, which is really unfair with testing, and again, tend to move forward and you forget. And this has really affected the black and brown community, is testing. It's not available. If you go get tested, it's $125. Now think about it. It's one of the reasons why we work with Dr. Whalen's team at the health department to get kids back in 7 days. But people who don't have children in school, every time they have the sniffles or a kid has known allergies every year, they have to get tested before they go back. It's $125. You can't do over the counter. You can't get the two at Walgreens or CVS or whatever, Lincoln Pharmacy or Mars Pharmacy for 20, or Crestwood for $25 for two. You have to get a PCR test every time they're out. And that's why we went from 10 to 7. But the reality is, too, we need to make testing available to people and do it cheaply. We need, one of the things we're pushing for in NISAC, we wrote a letter and we talked about is getting free testing back up again so people can get tested. Because, again, I have to say, I met a parent outside Central Med, and the father was so irate. It was his third time. He goes, $375 now I've spent to get my kid back in school, and I'm tired. I don't have the money. And I didn't really think about it at that point in time, saying how many other people just can't get tested because they can't afford the $125. How do you keep kids in school if parents got to pay $125 and not workers going back, or if you need it? So it's something we've been working on, and we need a partnership with many organizations to get this cheaper and get testing back up and running. That is free. That is free. So I support NISAC's recent letter to the Governor Hochul to help continue to purchase and distribute rapid tests and set up testing sites at universities and community centers like we had before. So, and there is some good news. 75% of our Albany County residents that are eligible have the first shot. 67% have the second shot. So we're almost there where we need to be. And this is definitely, and I'm going to get into some numbers, this is really about people that aren't vaccinated and why we continue to go down this path. And remember, any adult over 18 now can get the booster shot. And the vaccine weakens over time. It's like the flu shot. Do we not get the flu shot every 12 months? Right? It doesn't last forever. It gets weaker. And the same thing with the vaccine that everyone's getting. It has showed how much it drops. J&J, was the most effective, but it drops the quickest, down to 40% over a couple of months. So the booster shot, yes. And to everyone that said who got the first and second shot, there was the extra lines, and everyone's like, see, they knew. Well, it's just the way they print the card. It's the way they print it, but they didn't print a card for shots, or one shot. But I get it. No one wants to get a booster shot. They're afraid of it. They're tired of it. But please, you did the right thing for the first and second shot. Do the right thing and get the third shot and continue to protect yourself. So the booster shot for adults is available 18 and over. But I want to bring these numbers up. So far in November, there's been 14 COVID deaths. Over 57% of those people that pass away were not vaccinated. 57%. All 43 people that passed away in September and October and November, nearly 63% of them were unvaccinated, and nearly 35% were fully vaccinated. Dr. McKenna was just on the Paul Vanderberg show today talking about everyone in the hospitals unvaccinated. I don't know how many times we have to put it out. There are people that have gone into the hospital with 1 shot, 2 shots, but they didn't end up in ICU here in Albany County. I can't speak for the rest of the world. I do follow most of it, but I can't speak specifically county to county. But here in Albany County, the people that ended up in the hospital with 1 or 2 vaccines were just there for a couple of days and got out. Never got to the ICU, and thank God never passed away. And that's what we said. It's doing its job. So over the 41 currently hospital cases today, 39% are fully vaccinated, 61 are not, like I just said. If you're feeling sick, even if it's just a sore throat, low cough season, please stay home. And it's better safe than being sorry. As we're celebrating with friends and family this Thanksgiving, I encourage everyone to get vaccinated or get the booster, get tested before the celebration. We also need people to get the flu shots, so please go out and get your flu shots. And again, we don't want to see the spike in COVID. It went up, started to go down. It's kind of going back up again, and we'll see what happens over the course of the next couple of days. we just need everyone to do their part. I can assure you, I don't want to have to implement stuff like it's going on. Mayor de Blasio did down in New York City with mask mandates, and people have to have their COVID card shown to go into a restaurant, because I know restaurants are hurting. They're struggling to stay open. They're struggling to get workers. And I know, again, I challenge anyone in this room to walk out to any shopping center or any corner store. No one has a mask on, maybe one person if you're lucky. And I know what we said. And I'm not going to apologize saying that if we got fully vaccinated, we didn't have to wear the mask. I said that to all our county workers. And then I had to make people start wearing masks again in our buildings, because the workers that aren't vaccinated want to take their mask off and get other people sick. So, unfortunately, I had to punish everyone in the county for the bad actors that don't want to roll up their sleeve and do the right thing. So, again, I'm not trying to make this against unvaccinated people, but if we want to get out of this, we need to roll up our sleeves, get the vaccine, so we can move forward. And as kids, and we've had a great turnout at our health department for children. My deputy, someone in my office went through it with their children, and it was a great experience where they got to sit there and talk to the doctors. They got that one-on-one. The same thing with pediatricians, so a little bit slower with the children, but it's great. That's why we've done pods in schools, but we haven't done big pods, because kids from 5 to 12 have to be treated differently. You don't want to make them feel like they're going through this big maze and scare the hell out of them. We want them to feel comfortable. We want the parents to feel comfortable, and we want the parents and even the child who's 5 or 6 who might have a question about this, we can answer it, and we'll get through it. So again, I do want to say to everyone, I hope you have a good holiday. Please enjoy it, but do it safely, and help be part of the solution, not part of the problem, and we'll get through this. And again, remember, it's a marathon, not a sprint. So we're going to switch gears as I introduce my guests here, but I'll be taking questions on anything COVID related at the end. For a little good announcement here. I'm going to give a couple seconds so the briefing for the COVID's over with, and I'm going to get on to why I'm here too, and I have this special guest next to the left of me. So I want to give people that want to hop off a chance to hop off of Facebook Live, and the people that want to get on, and I'll get rocking and rolling in a minute. So, you guys ready? Sorry, jumped the gun. We all set? Thank you. This is an exciting day here for us in Albany County, and the person I'm about to introduce doesn't actually need to be introduced, because I think who watches pro football, you know who he is. But I do want to give a little background on this extraordinary, I'll say young man, he's so younger than me, young man, I hate to say that, it's making me feel old, but young guy next to me. Since 2011, Dion Lewis played for the Philadelphia Eagles, Cleveland Browns, New England Patriots, and the Tennessee Titans, of course, and our New York Giants. He's also a Super Bowl champion. But if you don't watch football, you may have seen Dion on TV for another reason. He was featured in one of our public service announcements encouraging people to get vaccinated. And even before that, in May of last year, he helped us with our 8-week teen challenge promoting safe, social distant activities through social media in Albany County. Dion has always been there in our corner, and I will say this, as he moved on in his career and has done exciting things, he never forgot his grassroots. He never forgot about his, probably because of his mother and family, but never forgot where he came from. And most important, I always say that the good thing about growing up in the south end of Albany, you never forgot about coming back and taking care of people. And that's what it was always about, taking care of your neighbors. And that's why today is so exciting to have you here. But I just kind of said it, Dion was born in the city of Albany. And aside from being a gifted athlete, he's passionate about giving back to the community, which is something we have in common growing up in the city of Albany. Now, we really have a great opportunity for Dion to help out here in Albany County, and we created a position. And I do want to say thank you to the Albany County Legislature, Chairman Andrew Joyce, Dennis Feeney, Wanda Willingham, Vote in Finance, and to all the legislators that are involved in the Black Caucus that really want to see us change. And if we learned anything from COVID-19, we have to do things differently, and we have to stay proactive. So we create the Community Health Wellness Development Coordinator. And with his name recognition, the way young people, especially young men, look up to him as a role model, he can help us connect our services of Albany County offers through them. One of the lessons we learned over the last 22 months dealing with COVID-19 is that some people are skeptical of government, and rightfully so. We need to do more to have that trusting bond between government and the citizens who are in charge of taking care of their safety and health. We need trust and a credible messenger. And who are more credible than Dion Lewis to be out front on a lot of these different issues? So you think about the position here we created. It's going to be with the Department of Recreation, our Department of Children, Youth and Family, and of course our Probation Department, our Department of Health, Mental Health, and others. And we're very truly incredible programs and services that we run in the county to get them into the community, to have someone talk to them one-on-one, and someone they can feel trusted in, and it can promote a great message. And not just the message of Albany County government and what we offer, but his own personal message. And understanding, and when he talks to these children, where he came from and the struggles you had growing up and how you can turn your life around in a positive way. This partnership I am so looking forward to. Yes, it's putting a big smile on my face because you have to change the way we do anything. I said reimagine government, and we have to reimagine how we deliver services, how people look at our services, and we have to change the face of government. And Dion, you're here to do that for us, and I do want to say thank you so much. As you help get the message out about the importance of getting COVID vaccines, you can help our Department of Health go into the communities that with still low vaccine rates and speak with them person to person. As a professional athlete, Dan also understands the ins and outs of exercise and nutrition, which some people say I might need. I'm getting there. I'm getting there. Maybe. I don't know. Maybe we can work on that. I don't know. And you can be a great spokesperson for both, which is great. So seeking true health equity for all county residents is something I'm going to strive for 2022. Something we talked about, the equity of health, and if you look into certain communities, the equity of not just the way COVID-19 has affected them, but the way diabetes, I can go on and on and on, heart issues in these communities. We need to address them every day, and even when hopefully COVID-19 is over with, we still continue to address these issues day in and day out. If I learned anything, there's some great announcements we're going to make in January and some way we're reinventing government to tackle these issues. And I do want to thank my staff, Dan Lynch, my deputy, Jeff Jameson, George Penn, Mary, and Mike McLaughlin, and Pat Alders, and Amna, and even Cam over there, and everyone on my floor, Sandy. I just go through the whole list, Luke and Mike McLaughlin. Thank you, because we have done extraordinary things, and this is one of them. So I do want to turn over to Dion Lewis to say whatever you want to say. And again, I look forward to this partnership. It's going to be exciting for the residents of Albany County and jumpstart a lot of the programs that we will be announcing in the near future. So thank you, Dion.
Yes, sir. I just want to start off.
You can take the mask off. No, I'm switching gears. There you go. It's all you.
I just want to start off by saying thank you to Albany County and Mr. McCoy for presenting me with this opportunity. I'm extremely grateful to be able to be in this position, help give back to the community I was raised in. I've been living in Albany since I was 5 years old, so just to be from here and being able to connect with some of the youth and help them understand that I'm from here. If I could do something positive, then anybody could do it. I'm nobody special. I'm a regular person just like everybody else. I just happened to get a little lucky and was raised by great parents in a great city. I think that when people hear about Albany, New York, they don't really see much. And I think that should change. And that's another reason why I've come back and I live in Albany County now. And people always ask me why you come back to Albany, and I just look at them. I'm like, 'cause this is home. No matter where I've been and where I've done in my life, Albany will always be home to me. And I wouldn't be the person I am today if I wasn't raised in Albany. Growing up and going to Albany High and then going to Albany Academy, it taught me a lot, and a lot of life lessons I've learned by being here. And I think it's important to help give back, and with people dealing with mental health, especially during this pandemic, especially with the gun violence going around, and a lot of it being younger kids. And I'm just hoping that I could come back and connect with these younger kids and even young adults, just to give them hope. And that's what it's about. I think that sometimes people lose faith, and I'm not going to say I could change everybody, but I just want to connect with some of the youth and let them know that that if I can do it, anybody can do it. You just got to put the right step forward and believe in yourself, do the right thing. Obviously, everybody gets caught up in doing wrong things at time, and that's okay. But you got to learn from it. I've been working with some kids in probation already since I've been here, and just let them know, just don't make the same mistake twice. And that's kind of what I've learned, and that's how I live my life. It's okay to make a mistake, just don't keep doing the same thing. Just kind of get better and learning. And I'm extremely grateful, to have a guy like him. Funny story, his brother actually was my Pop Warner coach, and until this day we're really close. To see what he's done with Lawson Lake, I just stopped over there yesterday and chatted with him. So just to see what all the great things that we're trying to do here at Albany County. We're trying to grow this place up and fix the community, and just get hope out there. That's all it's about. Just hope. Believe in yourself and never getting down yourself, and that's what it's about. And that's what we're trying to do here. And it's a great group of people, and who he's mentioned during his press conference. It's just a really great group of people who care about the community. A lot of people get involved in things like this, but don't really care. They just kind of do it. I think it's important. When they reached out to me, I couldn't say no. I've always been for giving back to the community, and that's what I'm continuing to do, and that's my purpose here. So I'm always going to be an Albany guy, no matter what I do or where I go, and this will always be home.
Thank you, Dion, and I'm glad that you accept it, and and continue to make Albany County your home as you always have, and giving back. So I'm looking forward to exciting new programs we're going to be launching, new ventures, and again, thank you for being part of this. We will take questions. Dan Lynch, my deputy, you should come on up here. I got a seat right up next to you for me, and I'm going to put you on the hot spot. But I do want to say thank you to Dan. It's been an incredible almost 2 years since he's joined me as my deputy, and I don't think you got a break, and you're getting a little bit grayer like me, so welcome to the Gray Club. Any questions?
So will you be able to offer testing? Can you speak more to the testing? Will you be offering free testing? I think that's a component that might be missing, especially people in underserved communities that want to get tested before Thanksgiving. Obviously, it's not going to happen now, but will you be offering free testing?
We are working on it, and I'm going to tell you it was alarming because, again, I want to say we didn't see that. But we are trying to set up testing again like it was before. That's why NYSAC, New York State Association of Counties, Steve Aquario, the director, we sent a letter to the governor to try to set up the mass testing again. And we're trying to get the home kids, and it's so hard to get the home kids. We've been trying to order them directly so we can get them to people. Them self-tests that you can get at over-the-counter are really effective, and it's come back, I think, 99% on them, if I stand corrected. So if you're positive on that, then you can go to PCR, and it's a lot cheaper to get 2 of them tested for $25. But yes, that's what we're trying to do. And I was hoping today I could have announced that, and I can tell you the logistics and trying to get it done have been a nightmare.
It sounds as if you're warning that if we don't get those numbers down, something is going to happen. What might happen?
We could go back. Look, I'm not going to advocate for shutting down because of like I talked about earlier, the mental health of people, and it's really. I think if you go back in time, 22 months, 23 months ago, it's really changed people's outlook on life, and it's really made little things more different. for people in the new world we're in because of COVID. So I'm never advocating for shutting down, but what I will start to do is, probably mandate masks in all over the county again, like they just did out in Erie County, mandate other things. And I don't want to do that. I think we've come far. I think we're almost there. And that's why I'm pleading with the viewers and listeners, please, just do the right thing and we don't have to do this. And I think, like I said earlier, I know people are tired of all this. And they're not going to want to hear it. But if you look at the steps Mayor de Blasio made in New York City, you look at the steps, not that I agree with everything like Mark Poloncarz is doing, and in the capital region we all got to work together. And if I take anything away from what this last governor did when we had to do everything as a regional approach and dealing with my 6 other counterparts, is working together, and it's easier if we all do it together than doing it separate, county versus county.
Quick question. Those vaccine clinics that you were offering, can people show up for boosters there as well? Is it only first and second doses?
Oh, they can show up for boosters, correct? Yeah. Boosters too, yes.
Thanks.
Okay, sorry. Good morning.
She's not giving up that mic.
No, I understand. I shouldn't be touching it. So when it comes to those restrictions, I know that you were just mentioning what some of those possibilities could be. What is your timeline for whether you decide to go in as a group and, do it with different regions, or if you're going to say Albany County is doing this and we're going to set some of our own restrictions?
So we're looking at the numbers, and again, if I base it, that's why I brought up like the 5% infection rate. If I base it on the matrix and everything last year, we would have already been there. I'm basing on hospitalizations and everything else, and again, in looking at the numbers, and Dr. McKenna was correct, it's the unvaccinated. And why do you penalize everyone else that has done the right thing? Because like I said, 75% of people in Albany County got the first shot. We said if you got to that certain number, we would loosen up all restrictions. I don't want to go back, but I will have no choice. If I'm not going back to that January of this year when we had 89 people pass away. So I will assure you, I will do the most unpopular things, because at the end of the day, I have to sleep, and my main job, as well as Dr. Whalen's, is taking care of the safety and health of the residents. And we will go down that road if we have to and make as many hard restrictions as we're going to have to do. If them numbers continue to trend, I mean, like I said, when we had 191 on Thursday and we're in the hundreds, it's alarming. And the reason why I brought up the testing is, what would that number be if we were testing? Because in the heat of this, we were doing over 2,000 COVID-19 tests a day, a year ago. We're lucky if we do a couple hundred a day now. Now imagine, I could be wrong. We could do 2,000 and that percent number could be way down. But the infections that we're seeing, I got to assume it's a lot worse than what we're seeing on paper.
Are you also considering hospital capacity? Because I know recently we've heard that a couple hospitals in the area have had some, COVID capacity issues. Is that also a factor when it comes to restrictions?
Yes, well, that's what we last year decided when they're doing all the matrix, the red zone, the yellow zone. I can't even remember. It's like playing football or soccer, right? Red, yellow card. We based it on hospitalizations and working with like Dr. McKenna, Dr. Reedy from St. Peter's, and looking at their ICU beds and hospital beds. But what has added to that factor, if you remember, I think it was a month ago we put out, we were at the lowest number we were, but a lot of it had to do with COVID infections, but staffing issues too, and you're seeing that. I mean, it's the one thing I remind my counterparts, but especially the Senate and Assembly members that are talking about all the stuff with health care. We had an issue before all this started. People weren't going into health care. Our nursing home had the same issue it had prior to all this, because not everyone wants to work in a nursing home. It's hard to get nurses and LPNs and CNAs to want to work in an environment like that. So this has been ongoing for all county governments forever. Now it's just getting highlighted because of what the previous governor did with the numbers, which, mind you, we always gave from day one, gave out our nursing home people that unfortunately passed away.
Last question, really quick. When do you think the next announcement or next step will be announced?
I'm hoping you're not going to see me next week, but I'm going to look after, see what the spike is after the holiday travel, make an evaluation with Dr. Whalen and her team and our team to decide what it's going to be. And if I see the trend continue, we're going to get a little bit of an increase after Thursday. But if it's like really to the point where we're in the critical zone, yeah, you'll see me sometime next week.
Okay, this question is for Dion. Can you talk a little bit about your day-to-day roles and kind of the duties that you'll have in this new position?
So pretty much just, trying to come up with ideas to,
Dion, can you take your mask off?
Oh, sorry about that.
Thank you.
Trying to be safe up here. But, no, so just pretty much just trying to come up with different ideas for us to reach the community and try to use some of my resources and people I know in the area to try to do that, as well as, the coach at Albany, he coached me at Pittsburgh, so I'm hoping to reach out to him sometime and see if we could do something with his players and kind of involve them as well, and just kind of things like that.
What exactly are you looking forward to most in this new position? Is it interacting with our younger generation in the county? Is it increasing that trust with the government?
Yeah, I'm really looking forward to working with the youth, the troubled juvenile youth that we have. Obviously, we have a big gun problem, and I'm just hope I can reach a few of those kids and talk to them and just try to get them distracted from kind of the street stuff and let them know what Albany County has to offer as far as different community service programs or different things like that. So just kind of connect them with that and let them know that I'll be there for them and I'll be there right along the way, outside, putting up playgrounds or whatever they need to do, and I'll be there getting it done with them.
My last question, this one is for the county exec. With the creation of this new position, how exactly is it being funded? Did you guys receive a grant? Is it going to fall on taxpayers? Can you explain?
It's funded from one of the positions we had vacant. We just retitled it and found a better use for the position. And it's going to be, like I said earlier, it's going to be multiple departments. It's going to be probation, DCYF, Parks and Rec, health, mental health, if you want to jump in, so it's actually a position that's going to be better utilized, and it's something that the legislature wanted to, and the Black Caucus, Bill Clay and Wanda Willingham, wanted to create a position that we can get into the community and start getting into the issues, like I said, of diabetes is huge in the black and brown community, heart issues, eating habits we got to change. So there's a lot of things that we always knew prior to COVID, but I always say, an emergency government always puts it a priority. The emergency goes away, and guess what happens? Their priority goes away. And we are doing a new approach that this is just one step of many announcements that we're doing to revamp government and how we address issues going forward. So I will say to the viewers and listeners, stay tuned because there's going to be a lot of new excitement. And again, we're reinventing the way we do services throughout the county.
Thank you.
Any other questions? Thank you, and I do want to wish Mary's mother a happy 90th birthday. So congratulations. You're younger than my mother-in-law, who's 105, and my mother, that's 110. So I do want to say you look good for 90.